It's a pleasure to be here and to represent a passionate subject of mine, hyperbaric oxygen therapy. And there's been a lot of research done on hyperbaric therapy for many, many years. Hyperbaric therapy as a therapy has been around since the early 1900s. We've known about hyperbaric environments since the 1600s, actually. What's really exciting is where we're going. And I'm going to talk a little bit about that with you all today. Can everybody hear me okay before I go? Yeah? Okay. All right. So I'm an internal medicine physician, and I specialize in hyperbaric oxygen therapy. And today we're going to talk about hyperbaric oxygen therapy in an integrative way, especially IVC, that's why we're here, the ketogenic diet, and some other integrative strategies. Oh, I'm based in the Bay Area, too, by the way. I'm in San Francisco. And I grew up in New York with this guy. So I have a chiropractor in the family, too, Ron, my father. And so my father is not your typical or that's not breaking your back. Let's say adjusting your back and adjusting your neck kind of chiropractor. He was the kind that was a functional medicine doctor before that word really existed. And he had a wellness center. Now that's a word we hear a lot now, right? But back in the 1980s, it was a relatively new term, not really bastardized by anybody who wanted to use the term. And he had a philosophy that I really resonated with at the time as a kid, and I still do now. This is his mission statement then and it is now, is to direct people to the realization that life and healing come from within, and that ultimately the promotion and maintenance of health is superior to the treatment of disease. It sounds as good as it did then, now, really. And my mission was going to be that mission. I wanted to be a chiropractor just like him. But I also realized that there were a lot of limitations as to what he could do. He was limited by his license. He was limited by how he was perceived by the audience of people that he was looking to convert to his way of thinking. So I decided to take the darker route to go to medical school. And when I went to medical school, my goal, though, was to figure out a way I could bridge this chasm, this alternative healthcare world that he was in, and the conventional world that I was not a part of yet. But I thought there had to be a way, and I was this high-minded 21, 22-year-old kid who thought I could bridge these worlds. I had the ability. It's nice to be 21 and 22 to think you can change the world. I think many of you in this room still think that you could change the world, though, and I know I can still. But medical school almost beat that out of me a little bit. And it was interesting that I found my calling in a very strange place. Has anybody been to Baltimore before? Does anybody know the Shock Trauma Center in Baltimore? All right, Frank knows, okay. And does anybody know what Baltimore is known for? It's known for Johns Hopkins, that's true. It's also known for a show called The Wire. Soft crabs are, actually, yeah, they're fantastic. Crabs are fantastic. Buckshot Walter, there's a good one too. It's also known for crime and shock and trauma. And so The Wire is a good example of that. And actually the military branches in this country and all other countries, not all, but many, come to shock trauma to learn how to treat gunshot wounds and gunshot victims and a number of other different types of traumatic scenarios. What I learned there was that there was this gigantic submarine-looking thing in the basement. And I saw patients with necrotizing fasciitis, or flesh-eating bacteria is the word we use in the regular press for it, along with carbon monoxide poisoning, go into this chamber and come out like different people. Now, mind you, I was on 30-hour shifts every 3 nights as a third-year medical student, and I was really tired, and I saw some crazy things. But this stuck with me, especially when I asked the technicians that were manning the chamber what was going on. Why did somebody with neck fash go in looking purple and like they were about to get all 4 limbs amputated, and then after they come out, look like they were almost going to salvage everything? Or somebody with carbon monoxide poisoning go in intubated on a ventilator and walk out of the chamber an hour and a half later. And when they told me it was just a combination of increased inspired oxygen and increased atmospheric pressure, just 2 things, it blew my mind. because I think all of us know that oxygen's kind of important. Maybe an understatement. And all you needed to do is add pressure to that to actually see these amazing benefits in these very sick patients. So that's when I got really excited. I was like, well, maybe there's something to this. And then fast forward about 5 or 10 years later, and I really took a deep dive, pun intended, into the hyperbaric literature to really understand what was going on and what we were doing in this field. And I saw that in this country, there was 14 indications that were covered by medical insurance. But in countries like Russia and China, they were using it for 80 different things. And the research was pretty good. It wasn't just kind of good. It was pretty good and getting better every year. And what it came down to, especially after I started getting more understanding of what was happening clinically, when I became a medical director of a facility in San Francisco, it really came down to 2 things: energy production and oxidative stress. Now, I use the word oxidative stress, or those 2 words, outside of this room, and people get scared. But not people in IV vitamin C, I know. Oxidative stress is the way hyperbaric therapy truly does its magic. Energy production is as important. And it came down to 4 real results of these 2 stimuli: reversing hypoxia, both short-term and long-term, decreasing inflammation, fighting infection, and an exponential release of stem cells from the bone marrow as well as neurologic tissue. Has anybody been in a hyperbaric chamber before, by the way? All right. Has anybody used it on their patients? Cool, all right. We have some knowledgeable people here. Okay, so like any good doctor from the East Coast, I have to give you some objectives here. So we're going to talk about definitions and history of hyperbaric therapy. We'll talk about how it works. We'll also talk about specifically why I'm here, hyperbaric therapy and cancer, looking at the ketogenic diet and IV vitamin C. Talk about my approach specifically, which is an integrated one and an optimized one as far as I'm concerned, which is looking at a holistic approach of how to approach a patient. It's not just about putting somebody in a chamber, most of the time. In fact, sometimes it's not even necessary, or sometimes it's not even the right thing to do. And then finally, I'm going to finish up talking about some precautions and contraindications to therapy. So as I was alluding to, diving medicine is how hyperbaric therapy got its start. And a lot of the terminology that we use is based on diving. And so that's really where we're going to start here. So the definition of hyperbaric oxygen therapy is the intermittent administration of 100% oxygen at increased atmospheric pressure. Has anybody worked in an intensive care unit before? So maybe a few. And so intermittent is very important. If you have someone that's exposed to high flow oxygen for weeks at a time, or if you have a premature baby, for example, you can get oxygen toxicity. It's possible in a hyperbaric chamber, but unlikely given that we're giving it intermittently. So typically between 1 and 2 hours of exposure daily, maybe Monday through Friday at the most, with the weekends off. And we're talking about 100% oxygen here. Does anybody know how much oxygen is in the air that we're breathing right now? 21%. You guys are so smart. 21% oxygen in the air that we're breathing at sea level. And we're increasing that usually to about 100% in the chamber. And then finally, we're increasing the atmospheric pressure around you when you're in the chamber. And this pressure is simulating the pressure that you would feel if you were underwater. So we all know that water is extremely heavy. If you pick up a bucket of water, you're going to feel that's a heavy bucket of water. But if you dive underneath the water, if you're swimming in a swimming pool, for example, you're not going to feel how heavy that is. However, it is really still heavy, I promise. And the further you go down underneath the water, the more that pressure is exerting effect on your physiology. At 2 atmospheres absolute, 2 ATA at 33 feet of seawater, you're above or you're underneath 33 feet of seawater, obviously. And at 3 ATA, it's 66 feet of seawater. 1 atmosphere is at sea level, just to give you some of the terms that we're going to use. And the further you go down deeper, the more pressure you have on your body, the more that's affecting your physiology. Does anybody know where this bridge happens to be? So my hometown, although I'm a suburban guy, used to go to New York City a lot. This is the Brooklyn Bridge. And it was during the building of the Brooklyn Bridge where the bends was first described, also known as decompression illness. Decompression illness is what happens when you come up to the surface too fast if you're underneath the surface of the water. What they realized, though, at the building of this bridge was two things. There was a separate group that was actually figuring out the physiology behind this, what was actually happening to cause decompression illness. But they also realized if you didn't die of decompression illness, if you went back down underneath the water, build this bridge, your symptoms went away. So as a result of these biochemists and molecular physiologists looking at the understanding of nitrogen bubbles being the issue, along with the clinical realization during the building of bridges like this one, hyperbaric chambers were developed. And the first type of chamber that was developed was called a multiplace chamber. Multiplace chambers can treat multiple people all at the same time. And this particular chamber is actually still, this is a modern hyperbaric chamber in Tel Aviv, Israel. And the Israelis have the largest hyperbaric program in the world. They're treating between 200 and 240 people per day in their hyperbaric facility, in their chambers. They have two of these, and they're actually going to be increasing to 4 by the end of 2019. Most of their patients are being treated on anti-aging protocols, actually. They have a rejuvenation protocol that they call it 60 hyperbaric sessions, 3 months, Monday through Friday, with diagnostics before, MRI scans, laboratory analysis, VO2 max, what else? Some other testing, along with hyperbaric therapy being the actual treatment. Well, they do some neurocognitive testing in the beginning as well. And at the end, they're doing all of those tests again. And they're seeing some amazing things on stem cell release, senescent cell, inflammatory mediator, downregulation, and others. And also new blood vessels in the brain, in the heart, and they just published a paper on erectile dysfunction, interestingly enough, showing blood flow changes in the penis. So this is the first type of chamber that was developed, the multiplace chamber. These can go very deep, down to 12 ATA or greater, to simulate the pressure that you would be underwater. The next type of chamber that was developed was the monoplace chamber. And I don't know if any of you can see my special guest for today that's inside of the chamber. Does anybody know who that is? Yes, Michael Jackson. So after I tell somebody I'm in hyperbaric medicine, about 75% of the time, depending on the audience, the next thing they'll ask me is, isn't that what, well, they'll ask the question, isn't that what Michael Jackson used? And some of you might be thinking the same thing. And he actually did use hyperbaric therapy, and not just to potentially do it for anti-aging reasons. He actually used it for third-degree burns that he sustained from a Pepsi commercial back in the 1980s. Does anybody remember that commercial, that accident? I see some of you nodding your heads. So he used it for therapeutic reasons, actually. And then if he happened to use it for his nose jobs or anything else, I don't know. Did he sleep in the chamber? Maybe. However, he did donate the chamber to a burn unit in LA after he was done with it. Another thing that he's doing in this picture that's not terribly cool is be in his own clothing. So again, I hope he wasn't using it at this time when he was being photographed. But anyway, so the chamber next to it is a modern version of a monoplace chamber. These chambers go to about 3 ATA, or 66 feet of seawater therapeutically. They're also used most commonly on the outpatient side, although they're also used inpatient as well. Finally, last but not least, are soft hyperbaric chambers. These are chambers called mild hyperbaric chambers. These are ones that can be used in your own home. They don't get to as much pressure. They don't use as much oxygen. They are not FDA approved for any indication other than acute mountain sickness. However, there is some good data coming up about their use in neurocognitive conditions. And actually, some of my colleagues, actually a naturopath specifically in Seattle, his name is Dr. Paul Anderson, has been using these pressure depths for cancer with actually some significant improvements. He's not just using hyperbaric therapy, as you can imagine. He's using it in a very naturopathic, holistic way, using things like DCA and the ketogenic diet and a number of other things, including ozone, actually. But soft chambers are the most modern, not the most modern, but they're the ones that have been coming, they've just come around most recently in our technology. So the experience of being in a chamber, if you're in a monoplace or a multiplace chamber, it's going to be different. Obviously, it's you or it's a number of you all together at the same time. And there may be therapeutic reasons, actually, to be in a multiplace environment if it's something if you're not in there for an emergency. But obviously, a multiplace environment's good if you have an emergency, if you need intensive care, much easier to perform in a multiplace environment. Either oxygen is given to you via face mask or hood, or it's given ambiently in the air around you. So ambiently, typically in the monoplace chambers, not in the multiplace chambers. And I got my dogs here to show you their big ears. The biggest thing you feel when you're in a hyperbaric chamber is you feel a sensation of pressure in your ears, just like if you were on a plane or a train. And if you can imagine, you start off at 0 feet of seawater, you dive down to, say, 33 feet. During that time, has anybody scuba dived? It's the same idea. You have to decompress your ears as you're going down. While you get down, or as you get down to the pressure, then you're good. You stay there 60 minutes, 90 minutes, depending on the pressure, and you come back up. Interestingly, evolutionarily, I think there's a reason for this. Going down is much harder than coming up. And I think this is whoever created us making us realize we should not be diving down because we may not get up. However, if we do get down, we need to get the F up very quickly so we don't die. So at least that's my running thought. I don't know. All right, so now coming into how hyperbaric therapy actually works. So we talked about how it was a combination of oxygen and pressure. But if only Lance knew that there was another way to increase your oxygen carrying capacity. So oxygen carrying capacity is usually predicated on how many red blood cells we have in circulation. Red blood cells carry oxygen. That oxygen comes from our lungs, goes to our tissues, and performs all of our physiological functions. There's a couple ways to increase your oxygen carrying capacity. One of them is to increase your red blood cell mass. And there's a couple legal ways to do that, and there's a couple illegal ways to do that. The legal way, does anybody know the legal way of increasing your red blood cell mass? Right, so altitude training. So you're training at altitude, you naturally increase your production of epigen, the hormone in our body that increases red blood cell mass. Illegally, you can take epigen as a drug, or you can auto-transfuse yourself. You can take blood away from yourself about 90 days before a race. You regenerate all your red blood cells in about 90 days, and then right before the race, give yourself some extra red blood cells to increase your oxygen carrying capacity. But there's another way. You can get yourself in a hyperbaric chamber, because we're not actually doing anything to the red blood cells. If there are red blood cell sites that can be saturated, we will saturate those. But the key to hyperbaric therapy is not its effect on the red blood cell, because most of us are doing just fine with our red blood cells at sea level. The key is in the pressure, because when we pressurize your body, your physiology changes, and we are able to drive oxygen not only on the red blood cells, but into the plasma, or to the liquid of the blood itself. In this test tube here that's been spun down via centrifuge, you can see how much of our bloodstream is actually plasma and has very little oxygen in it at sea level, at baseline. But when you add in pressure, you're using something called Henry's law, which states that the more oxygen that we have under pressure, the more of that gas is going to go into liquid form. It's a simple physics law. And all hyperbaric therapy really is, in essence, is physics as far as its mechanism of action. So because of this pressure, we are driving supraphysiologic levels of oxygen into the body. So this is an example. So at 21% oxygen sea level, we're getting about 55 millimeters of mercury at tissue oxygen tension levels. When you go to 3 ATA, 66 feet of seawater, you're increasing that tissue oxygenation by a significant proportion, 500 millimeters of mercury. Why is this significant? It's at 3 ATA that you no longer need red blood cells to perform your physiologic functions, because we can saturate your plasma with so much oxygen that they're not required. Now, these studies weren't done in humans. These studies were done in animals. However, it's used therapeutically for severe anemias and also for Jehovah's Witnesses that don't want red blood cells because of their beliefs. You can temporize people in the chamber because of this effect. At 2 ATA, just right in between there at 33 feet of seawater, you can saturate enough oxygen to go about 4 or 5 times more in micron depth outside of a blood vessel. So think about that. So if you have a blood vessel and it's damaged, but you have blood vessels around it that aren't, you're now able to diffuse oxygen 4 or 5 times further into tissues. And that has significant potential. As far as mechanisms of action go, I just wanted to point out this paper. It was a review article by Dr. Angela Poff, Dr. Dom D'Agostino, and Don Kernagis on oxygen and cellular damage versus protection. It's a fantastic article, and I highly recommend it if you have any interest in learning more about what I'm about to talk about. They do a fantastic job. And so, this didn't come out so good, but I think you get the effect here. So what we're going to be talking about for the rest of the lecture after these next 2 slides is the immediate effects of hyperbaric oxygen therapy, which are really related to oxygen delivery, oxidative stress, and pressure. We also have the long-term effects of hyperbaric oxygen therapy, and these are usually seen in conditions outside of cancer when we're looking to really optimize physiology over the long term, and we're going to talk about that a little bit, but just to kind of frame this conversation for you. So the first thing that happens when you get in the chamber, or one of the first things, is that you have a vasoconstriction occur. This is related to oxidative stress. So one would think, well, that's not good. You don't want to constrict down blood vessels. But if you have injured blood vessels that are leaking out stuff that shouldn't get into the tissue, that are causing inflammatory reactions, that are causing swelling, and then suddenly you constrict down those blood vessels, all of a sudden less swelling is going to occur, less inflammation is going to occur. The net oxygen delivery is still greater because we've increased the amount of oxygen in circulation because we've saturated that plasma. We also decrease bubble size, and this is why hyperbaric therapy is so helpful for decompression illness and also air embolism. If you have a balloon and you pressurize it, that balloon is going to get smaller. It's just physics. So that's what's happening in the chamber directly in somebody that has decompression illness or air embolism. You're also obviously going to be mitigating hypoxia and reperfusion injury because you're allowing less tissue downstream of any injury to deregulate, become ischemic, and have the cascade of cytokine and hormonal release that makes it even worse. So you're maintaining energy production or even enhancing it in some ways. You're profoundly decreasing inflammation and actually directly decreasing pain. You're causing an exponential release of stem cells, both from the central nervous system as well as the bone marrow itself. And this is oxidatively mediated. You're increasing neutrophil and macrophage activation and efficiency, the first step in wound healing. You're also killing bugs, anaerobes and facultative anaerobes. Example of a facultative anaerobe is Staph aureus, MRSA, or Lyme disease. Killing bugs like fungus as well, and probably even bugs that like oxygen at higher levels of oxidative stress. There's a lot of crossover here with ozone, as I'm sure Dr. Schellenberger can talk a lot more than I can. But potentiates antibiotics. And one last thing about potentiating antibiotics is also potentiating other therapies that are working in conjunction under the same mechanisms of action or similar, like IV vitamin C. So a treatment protocol of hyperbaric therapy works on the epigenetic realm. Have you all heard about epigenetics? We all understand that epigenetics is the idea that we're working on changing how proteins are transcribed from our DNA. Hyperbaric therapy has an effect on about 8,000 genes, at least, with suppression effect as well as expression effects depending on the genes. Expressing genes that are more responsible for growth, decreasing inflammation, and suppressing genes that are responsible for inflammation and programmed cell death. So a treatment protocol in my mind can be anywhere from 3 to 120 treatment sessions. That's a huge range, but it depends on the person and the condition. But we're optimizing all stages of wound healing. We're actually causing a reactive antioxidant response. And that's extremely important. The antioxidant response is just as important as the oxidative stress in a lot of these conditions that we're treating. Interestingly enough, cancer cells typically don't have the ability to produce this antioxidant response. So superoxide dismutase, catalase, glutathione, the NRF2 transcription pathway, they're all involved. Now we're getting more stem cell release. We're getting activation of these stem cells. We're getting them to migrate to the areas of injury and inflammation. We're causing angiogenesis, so revascularization. Extremely important for the health of tissues, not only to oxygenate it, but to allow that tissue to be vital over the long term by providing it the scaffolding that it can really manifest this health over the long term. Downregulating inflammation via several factors, preventing cells from dying. This is more in the acute setting, and sometimes also seen in the more late stages in the setting of really reoxygenating tissue. And growth factor signaling. So scaffolding is how I like to describe it to patients. We're recreating the scaffolding of your tissue. We're rebuilding it from the inside out, new stem cells, new blood vessels, new connective tissue, new cartilage, new bone. We can recreate that in a hyperbaric environment. How are we guys doing? How are we doing so far? Is the belly like really full and like, oh God, the brain not getting enough oxygen? How are we doing? Do you want to stand up for a second? Standing up? I think we should, let's everybody stand up. Because this is, I'm changing gears now too, so let's stand up. Does anybody need to get in the chamber? I didn't bring it with me. Hands up over your head, all right. Deep breaths in and out. Okay, I needed it too. Maybe a drink of water. Okay, all right. All right, good. I'm gonna shift gears now and talk about, why we're here. And I thought it would be good to, just take a little break right now. And okay, so feeling a little bit better? Slightly, all right. So depending on what we're doing, the protocols in the chamber change. And I think one of the challenges in my field is that there's lots of nuances in this. It's very person dependent in general, but these are some rules that we tend to follow. The more acute the condition, the less treatment that is needed. The more chronic the condition, the more. Makes sense. Neurologic conditions are usually treated at more shallow pressures, where non-neurologic conditions are typically treated at deeper pressures. Chronic inflammatory conditions often require maintenance treatment. That also includes autoimmune diseases, I should also mention. Time at depth, 60 to 120 minutes in general. And treatment regimens, anywhere between 3 sessions to 120, sometimes more. 3 sessions is really your minimum when you're looking for an antioxidant response. But that might not be the case in cancer, as you can imagine. So our treatment protocols in cancer are different. Often, though, hyperbaric therapy is done in successive days because of these epigenetic effects that I was mentioning. Sometimes even done twice a day in some cases. So this is the approved list in the US for hyperbaric oxygen therapy. And I talked about bridging that chasm before, bridging the alternative and the conventional divide. This is one of the ways I'm able to do that, because I can treat patients with Medicare and other conventional insurance with hyperbaric therapy for these indications, and is extremely helpful and massively underutilized, of course. But delayed radiation injury from cancer treatment is fantastically sensitive to hyperbaric therapy. Even if it's mild, but especially if it's severe, we see these patients massive improvements in their quality of life. Diabetic foot ulcers, we save amputations every day, small and large, often after people have already had amputations, and now they come and get hyperbaric therapy, and all of a sudden we save them from an amputation. And I've had this question multiple times to me: why didn't they send me before the first amputation? Refractory osteomyelitis, so refractory bone infection, sudden hearing loss, at-risk flaps and grafts, either done for superficial reasons like plastic surgeries or done for breast reconstructions after breast cancer surgery. The ones in gray here are the ones we typically see in an environment, in an acute care environment like the shock trauma center that I trained in. So investigational hyperbaric therapy, the list is probably grown now to about 100 indications or so. This is just a little brief list. Now, of course, I'm going to focus here on cancer. However, there's a significant amount of data in a lot of different fields that I just wanted to point out briefly. And if any of you have any questions about these, we can talk about them later. So patients post-stroke, there's some significant data that hyperbaric therapy can help with stroke recovery, acute stroke, as well as patients 3 months to 3 years post-stroke. a new study coming out of China looking at acute stroke, and a study out of Israel, 3 months to 3 years, that came out about 3 years ago. I've seen patients with reflex sympathetic dystrophy or complex regional pain syndrome come off all of their medications after hyperbaric treatment. Inflammatory bowel disease, ulcerative colitis, and Crohn's. Ulcerative colitis tends to be more sensitive to hyperbaric treatment rather than Crohn's, but they both do significantly improve. Refractory patients coming off their medications. Chronic fatigue syndrome, it's a huge category. However, in a multidisciplinary way, hyperbaric therapy can be very effective. I have a lot of fun in regenerative medicine, anti-aging, and optimal performance. In fact, that's why Dr. Ron and I first met, because of my relationship also with Dave and other people in the optimal performance field, because hyperbaric therapy is optimizing physiology, is really what it comes down to. New stem cells, new blood vessels, decreasing inflammation. This helps with people that have conditions, but it helps people that just want to feel better as well. And so we're seeing that across the spectrum in the optimal performance regenerative medicine fields in combination with stem cells, PRP, and other novel therapies. So some great work also being done in dementia, mild cognitive impairment, traumatic brain injury, some fantastic literature that's come out in the last 5 or 10 years in patients post traumatic brain injury or post-concussive syndrome. We're seeing some amazing things in kids, adults, veterans, etc. Lyme disease, in a multidisciplinary way. Autoimmune disease, the same deal. Small intestinal bacterial overgrowth. We know that we can help people heal about 30 to 70% faster from a regular surgery. So, of course, that's not going to be covered by insurance, but that could matter for people. It matters to me when I've gotten surgery. So. Infertility, opioid withdrawal, and many more. So let's now focus on cancer and hyperbaric therapy along with the ketogenic diet and IV vitamin C. So the first thing to mention is that this is when you do your PowerPoint on a Mac and try to transfer it to. Has anybody done this? Yeah, I should have learned my lesson. Okay, anyway, hyperbaric oxygen therapy in cancer. The first question I get from doctors is a very reasonable one, along with patients asking the same question. Well, won't hyperbaric therapy cause cancer? It makes new blood vessels, it decreases apoptosis. Is it going to make my cancer grow or come back? And there's been several reviews looking at this, and none of them have shown any pro-cancer growth effect or the return of cancer in a hyperbaric environment. And I think there's a lot of reasons for that. Many of them, most of you, or at least many of you in this room, could likely surmise as to why. We know hyperbaric therapy doesn't grow the same, cancer doesn't grow the same way regular cells grow. It grows in a hypoxic environment most of the time. So the blood vessels that are formed in cancer are not growing from the same stimuli that are growing in a hyperbaric environment. So it's important that many reviews have shown that hyperbaric therapy does not cause cancer or make cancer grow faster. It's used in various ways in cancer. We've talked about delayed radiation injury already. We're going to talk more in depth about the ketogenic diet, IV vitamin C, and hyperbaric therapy. It also is a chemo and radiation sensitizer. In chemotherapy, it's likely because of the oxidative stress hyperbaric therapy is also promoting on the cancer along with the chemotherapeutic agent itself. With radiation, radiation is oxygen sensitive, so you need oxygen in the tumor bed if you want radiation to work. You've heard already from me, hyperbaric therapy is going to help with that. So there's a couple studies that are looking at especially hypoxic tumors like glioblastoma in the brain and combining hyperbaric oxygen therapy immediately following it radiation therapy to see if you can have more of an effect, and it seems like it can. Surgical recovery, this makes sense. I already mentioned that hyperbaric therapy is going to stimulate the wound healing cascade, make it work faster. Just in an oncological case, it would be the same thing. Cancer prevention is very interesting and very provocative, but the idea that you combine something like the ketogenic diet, hyperbaric oxygen therapy, and IV vitamin C all at the same time to potentially prevent any cancer from growing. I mean, we all know we have cancer all the time, and our body is taking care of it. But maybe this could be another strategy. So I'm guessing, and I'm sorry I wasn't here yesterday, but probably Dr. Winters and others talked about the ketogenic diet a little bit and what that means and what it's all about. The idea really is just in the macros and how much fat carbohydrate and protein that you're eating. Classically, the 4-to-1 ratio is as it's described here, although this is very classic, of course. And the idea in cancer, as most of you know, is that most cancers potentially don't do well in a ketogenic environment. They get starved of their main fuel called glucose. So there's been a lot of amazing work being done in the field of the ketogenic diet, with Dr. Dom D'Agostino's lab being probably the primary location for cancer. And also some fantastic work outside of cancer, looking at how the ketogenic diet can help. And Dr. D'Agostino's lab looked at one particular study combining hyperbaric oxygen therapy in mice, the ketogenic diet, as well as ketone supplementation. He published a study before this just looking at the ketogenic diet and hyperbaric therapy. The ketogenic diet on its own took a glioblastoma model of metastatic cancer and decreased the metastatic burden about 40%. When he combined it with hyperbaric therapy, the metastatic burden went down to 80%, so decreased 80% of the metastatic burden. So significant. Interestingly enough, hyperbaric therapy on its own had no effect, interestingly. So we're looking at a very interesting combination of therapies here. We're looking at an oxidative therapy, hyperbaric oxygen therapy, and we're looking at a ketogenic diet or ketosis that's protecting normal cells from oxidative stress. But the cancer cells don't have that same ability, and they don't have the same ability to produce their own antioxidant response. There's only been one published study in the literature, this is actually a case study, human data looking at the ketogenic diet combined with hyperbaric oxygen therapy. This is in a patient in Turkey that had a combination of metabolically supported chemo, which is insulin-potentiated chemotherapy, the ketogenic diet, hyperbaric oxygen therapy, as well as hyperthermia. This is a lady that had stage 4 cancer, breast cancer, and had a complete remission using a combination of all these therapies together. So IV vitamin C wasn't included, but it also shows the potential of combining oxidative therapies in a very physiologically understandable way in a patient and seeing what we can see here. And this is what we're doing in clinics all around the US and having some significant results. So proposed mechanisms of hyperbaric therapy and the ketogenic diet or ketosis together. The first one, and the reason why Dr. D'Agostino got involved in this work, is it does decrease oxygen toxicity. And we'll talk about what that means, but that can manifest as oxygen toxicity seizures. So that's because you're decreasing reactive oxygen and nitrogen production and enhancing antioxidant capacity. So that's a good thing. You're protecting normal cells. Again, we don't think cancer cells have this capability. And so as a result of that, you're protecting normal cells at the same time as you're putting more oxidative stress on cancer cells. Ketosis itself also seems to increase blood flow, interestingly enough. So there's some new studies looking at how hyperbaric therapy, which also increases blood flow by increasing new blood vessels, can work together to heal wounds. They also can decrease inflammation synergistically, improve energy production. We know that fat itself, which makes ketones, is a much better and much cleaner source of fuel as we get older, especially, as opposed to glucose. And there's obviously the synergistic potential with other therapies and in other conditions: cancer, traumatic brain injury, wound healing. So as Dr. Ron was saying, there is not a lot of data on the combination of IV vitamin C and hyperbaric oxygen therapy, and I would love to be able to change that. There is some compelling data, though, to make us interested in pursuing this more. And anecdotally, in our clinics, the ones that I'm affiliated with and I consult with, we are seeing these results in patients as well that are making us think that there is something here that we really need to explore. Maybe some high-dose melatonin, too. I don't know. In any respect, this is a study that was published in 2014 that I found fascinating. I don't know if anybody has seen this, but it looks at, it's called the ROS-induced cytotoxicity of ascorbate is attenuated by hypoxia and HIF-1 alpha in 60 cancer cell lines. Has anybody seen this study? Yeah, it's a fantastic study that looked at 60 cell lines and looked at what we believe really is happening in a metastatic cancer model. We think that many cancer metastases are hypoxic. And as a result of that, the susceptibility to IV vitamin C might not be at its best. And actually they actually showed this in this study, in this in vitro study, that it took a lot more IV vitamin C to be cytotoxic on these cells because of their significant hypoxia. So what if you could reverse that hypoxia? What if you can reverse it and then treat with IV vitamin C? What they were showing here in this study is that the levels that were needed of IV vitamin C to treat these types of cancers was higher than you were giving in the clinic most of the time. And so what could you do to decrease the amount of IV vitamin C you needed? Maybe it's just reversing hypoxia. Very interesting. And so hypoxic conditions and HIF-1 alpha signaling, which is HIF-1 is something that's released in hypoxic environments, both present in cancer metastases, confer resistance to cancer cells towards ascorbate-induced cytotoxicity. So they postulate in the paper, well, what if you were in a hyperbaric environment? Could that potentially help? Because now you're reversing that hypoxia. You're flooding in oxygen, making them potentially more susceptible to IV vitamin C. Another study that was done in the lab of Dr. Dom D'Agostino, and Janine de Blasi was his PhD student, and that actually they published this abstract. The rest of what I'm going to show you was not published. This is directly from his lab, courtesy of Dr. Dom. The anti-cancer effects of ascorbic acid with hyperbaric oxygen therapy in vitro. And so they were looking at specifically glioblastoma cells. And they were looking at two different populations, one called VMM3, another one called U87. And this graph is not going to be very surprising to you. When they got to about 0.3 to 0.5 millimolar concentration of ascorbic acid, they had significant cytotoxicity, cell death that they saw. Also at 2 and at 5, but not significantly more than 0.5. Now, when they added in hyperbaric oxygen therapy, what they did is they put the patient in the chamber at 2 ATA, and they put them in there for about 2 hours, actually. They saw that there was significant potential at the 0.3 millimolar ascorbic acid concentration, where hyperbaric oxygen therapy, when it was combined, had a significant increase in cytotoxic effect. Interestingly, it did not have the same effect at the higher levels, but it did at the lower levels. And I have a couple thoughts as to why that might be, which I'll share in a minute. But interestingly, you needed less IV vitamin C to see a significant cytotoxic effect. They also looked here at how hyperbaric therapy sensitized cells to being more cytotoxic, so more cytotoxic effect. And they looked at various concentrations here. They looked at 0.25, 0.3, 0.5, but interestingly, at 1 and at 5, there was no difference. Interesting, again, but a significant cytotoxic improvement at the 0.25, 0.3, and at the 0.5. Now, the U87 cells in this particular study, Janine doesn't think that they were actually done correctly. She believes that there were some plating issues with them, so not terribly sure what to do with this data, honestly, and that's why it wasn't fully published. And these studies are being redone at the moment. However, there was one more interesting idea that came out over this. So what they also did in this study is that they tried to figure out how IV vitamin C was working at the cellular level. Was it really an oxidative effect? And what they did as a result to figure that out is that they gave these cells antioxidants. They gave them N-acetylcysteine and catalase exogenously. Both are antioxidants. And they found in the U87 cells, interestingly enough, in this case, that if they gave those two, it rescued the cells. So the cells didn't die in the presence of IV vitamin C. However, if you also gave those cells hyperbaric oxygen therapy, it still allowed there to be a cytotoxic effect. So it seems, and this is just very preliminary, that hyperbaric oxygen therapy may be able to allow cytotoxicity to happen because of the additional oxidative stress that it's putting on these cancer cells, despite there being antioxidants around, interestingly enough. So in the end, we still don't know a lot about how these things work together. What we do know is that hyperbaric oxygen therapy enhances H2O2 production. And it does this via ascorbic acid oxidation and redox cycling. It also may overcome antioxidant production. It's also possible that it might facilitate iron influx into the cells themselves via some iron receptors. And in the first one that I mentioned for the first study that I presented, that it may also be allowing the oxygen to get to these metastatic tumor cells, and then as a result of that, decreasing resistance to IV vitamin C therapy. Now, why didn't hyperbaric therapy help at the higher doses? I have a couple thoughts here. I think it may be, this is an in vitro model. It's not in a person, right? We don't, these cells were not hypoxic in the sense of like a tumor cell would be hypoxic. So it may not have the same effect. It's a little bit unclear. But again, this research is new. We know physiologically and understanding how these two work that there can definitely be a synergistic potential. And that's been my experience in my clinic, in the clinics that I consult with around the country and the world. We're using IV vitamin C. We didn't know first when to use it. Should we use it before hyperbaric therapy or should we use it after? Now we use it after all the time because of some of this information. We did it after before because of just simple reasons of having to go pee in the chamber. Because if you give IV vitamin C in a huge fluid load before you go into a hyperbaric environment, yeah, it's a lot of fluid, you might have to pee, right? And it's not that easy all the time to be able to do that. So now we typically use it afterwards as a result of some of this information, because now we can sensitize to IV vitamin C potentially, which is very exciting. Now, is that always potentially the way to do it? Maybe not, I don't know, but that's what we're doing. And then as far as how often to give IV vitamin C and how often to do hyperbaric oxygen therapy, as I was alluding to in the beginning, we are not looking for those epigenetic changes in the hyperbaric environment, okay? We are looking for hyperbaric oxygen therapy to be an oxygen stimulus, to be an oxidative stimulus, and potentially a pressure stimulus to help with detoxification. Now, the other stuff, helping with wound healing, angiogenesis, stem cell release over the long term, that's helpful, but that's not really what we're looking for, at least initially when we're combining it with other treatment programs. So a lot of this still remains to be seen, and a lot of this has to be personalized. And that's what we do. I work with clinicians all over the country that don't do hyperbaric medicine, and we figure out what else is this patient getting? Are they getting ozone? Are they also getting 10 other treatments? Are they taking something else that may also be an oxidative stress? And you have to be able to kind of use the mantra, go slow and start low, right? So, and that's what we do in the chambers too. I don't just immediately put somebody at 2.5 atmospheres while they're taking everything else and say, let's see how you do. It's just not the way to do it most of the time. All right, my view of hyperbaric medicine, and I mentioned this already, is that it should be an integrated idea, okay? We're not looking at this chamber as saving the world. It can help save the world, maybe, in some cases, but it has to be done in an integrative way. And this is my approach, and my approach relies a lot on all of you that are in this place right now, I was gonna say in this chamber, you're not in my chamber. in this conference. So because it's really a multidisciplinary approach. I don't pretend to be an expert in a whole lot of stuff, okay? I know a lot about a little, okay? And then I know a lot about hyperbaric oxygen therapy. And I know a lot about health optimization medicine, which is a program that I've developed with some colleagues, pioneered by a mentor of mine, that looks at a foundation for all of us. And I'll talk about that in a moment. But functional medicine, expert referral, adjunctive technologies, these are all extremely important, okay? And I often think of myself as a conductor. I only see patients for hyperbaric medicine and for health optimization medicine, but I love talking to colleagues across the world, my friends in Tel Aviv, my friends in Argentina, my friends in Texas or in Colorado or where else. I love it because that's what really gives me the most satisfaction, knowing that all of us, or a lot of us, are working together, knowing that none of us have all the answers, and I don't pretend to, all right? So, and then of course, hyperbaric therapy, if it's appropriate for the patient, When we're using it in cancer, it's going to be an out-of-pocket cost, okay? It's not going to be something covered by insurance unless they've had a radiation injury in the past. So all of this must come into play when we're looking at a treatment protocol for a patient. So health optimization medicine, as just a brief primer on it, is a foundational approach to health. It's not focused on disease, it's not focused on cancer, it's not focused on chronic fatigue. Cellular health, gut health, immune health, food sensitivities, basic stuff that most functional medicine docs are doing, but what we've done is just take a separate track, a separate paradigm, and just take it outside of the regular model and just make it its own thing. And as a result of that, it makes it more universal. I do believe that everybody does need the right vitamins, minerals, cofactors, antioxidants, good gut health, at least general gut health, avoid foods that they should be eating, get good sunlight, the usual stuff that most of us understand, but then put it in a beautiful package for people and then build on that foundation. So that's what health optimization is all about. It's a nonprofit entity. And so, our goal really with this whole thing is to make it a new paradigm, but also get it inside of medical schools and university education. So my approach for cancer specifically is to start off with health optimization medicine if possible, but I rely on functional medicine doctors a lot, especially if there's time. Press pulse techniques, has anybody heard about press pulse before? The idea, the ketogenic diet is a press technique. The idea is you stay on that and you pulse with various other things on top of that. So hyperbaric oxygen therapy being one, IV vitamin C being another. We have some interesting ideas of using something called antioxidant overdrive. The idea is that you downregulate the body's own ability to produce antioxidants, and as a result of that, you make cancer cells even more susceptible than they were before to oxidative stress. And so ideally, you do this with knowing all the levels, but if you don't know, you can just massively supplement for a couple weeks with some antioxidants, and then you're downregulating the whole body's ability to produce them. Ideally, or hypothetically at least, that could potentiate some of the therapies that we're doing. Now, this is something that hasn't been studied. I've used it in some patients, and I have seen, at least on early stage cancer, some significant results, but I can't speak to it over and across more than that. But it's a pretty exciting way of thinking, I think. I refer to physician advocates, those that really can do a lot of the groundwork on studies looking outside the country. There's a group in San Francisco specifically that I work with. And then integrative oncologists, if you guys don't know one, find one or ask me. These people are amazing. They can do both the regular chemotherapeutic ideas, but they can also look at all the other alternative things that are on the market or what's happening. I have a fantastic relationship with a few of them. And then technology is also important. Some of the high-tech things like saunas, cold thermogenesis, it doesn't have to be high-tech. You could just find a cold stream somewhere in Kansas. Or you can do some of the ancient practices like meditative techniques and other mindfulness practices, which are extremely important. Okay, to finish up, briefly, I want to talk about some of the precautions. So we talked about oxidative stress. In general, in this group, I know we're not terribly worried about oxidative stress. However, the abundance of people that I speak to care about oxidative stress, and it is important, especially in people that have a lot of it ongoing. If you have chronic fatigue syndrome, an autoimmune problem, and you don't have a lot of the antioxidant capacity, you want to consider supplementing with antioxidants. However, as I said to you earlier, hyperbaric therapy does have the ability to have that reactive antioxidant response. So it's not just we're causing oxidative stress, we're also causing a reactive antioxidant response. And that gets to a pretty high level, about treatment 3, for example. But in patients that have high oxidative stress to start off with, I will often supplement with antioxidants. I try to test if possible. I like that quote by Dr. Riordan before. You don't know what you need until you test. It was good. Anyway, some other side effects of hyperbaric therapy. I talked about the ears already. So for most people, it's not a problem, but you can get middle ear trauma if you're not paying attention in the chamber or the technicians are not paying attention to you. You can get sinus pain if you have any sinus congestion, if there's middle ear fluid in there. Very easy to remedy. CNS toxicity is very rare. This can manifest as oxygen-induced seizures. We have various ways of mitigating this, but it's very rare at the treatment pressures that we use. Dr. D'Agostino was looking at preventing CNS oxygen toxicity in Navy SEALs that were going to 3 atmospheres absolute, which is 66 feet of seawater, very deep. On 100% oxygen, you can last about 15 minutes without a seizure. With a ketogenic diet or ketogenic supplements, you can last an hour or longer because you are reducing oxidative stress. Pulmonary toxicity, also very uncommon if you have normal lungs. Cataract maturation, so if you have cataracts, they may mature faster in an oxygen-rich environment. However, they don't happen in the environment de novo. They happen this only happens if they're already there. Oxygen-enriched environment related, all I mean by that is it is a flammable environment, so you don't want to bring in anything there that might be flammable. And that kind of brings me to one other point. It's really important if you do get hyperbaric medicine or if you're going to be performing it in your clinics that you do follow some safety protocols. One of the major ones is making sure that people, in my opinion, should not go in their own clothes, especially in the hard chambers, both the monoplace and the multiplace chambers, because not only the clothes aren't usually the issue, it's what they bring inside of those clothes that they forget that are in their pockets and things like that. So in all the clinics that I work with and all the patients I talk to, safety is our #1 priority. Do no harm, right? That's why we're here. So that's what I mean by oxygen-rich environment. It's also an enclosed environment, so some people can get claustrophobic, but it's pretty uncommon in some of the newer chambers that we have. And as far as additional contraindications, why can't you get into the chamber? The only absolute contraindication is that if you have an untreated pneumothorax, go to the hospital. Okay, obviously. Other than that, the rest are relative in the sense that we can put people in the chamber here, but they take significant oversight by doctors and technicians to understand what the risks are. If you're retaining CO2 at baseline as a COPD patient, probably not a good idea. If you have bullous lung disease, if you have air pockets, those air pockets can actually burst when you come out of pressure, just like a balloon. So we are very careful. Severe asthma, seizures, if you have severe heart disease, if you're claustrophobic, but most patients don't have any trouble. So this is my last slide. I think hyperbaric oxygen therapy is a very simple technology, and that's why I really liked it when I found out about it when I was in training. It's just oxygen and pressure. We're making energy and causing oxidative stress. It's that simple. And then as a result of those processes, we're reversing hypoxia, so we're reversing it immediately, and then we're creating new blood vessels in the long term. We're decreasing inflammation immediately and decreasing it in the long term. We're killing bugs, we're causing stem cells to release, and then we're also, what I should also put up here is we're synergizing and integrating with other therapies that are also doing the same things and maybe making them work better. And I think we're just at the beginning, or really even a tipping point in my field as to where I see hyperbaric therapy going. Most of you have heard about it now. Some of you have been in the chamber, and you're going to see more of this. These chambers are becoming a lot easier to bring into clinics. It doesn't require a full build out to make a hyperbaric facility anymore. And as the pressures go down as to what we need, as a result of stacking with other therapies, it's going to be even easier as we get more data. Thank you guys very much for listening. I appreciate it.
So just, we'll take questions, but I just want to just clarify something. So in my understanding, in terms of the ability of hyperbaric oxygen to have an antioxidant effect, are we talking about the fact that you're relieving the hypoxia of wounds and maybe the relative hypoxia of certain cells and such that you're getting more oxygen through the mitochondria, more ATP formation, and the ability of the cells to make glutathione peroxidase and things like that? It's a whole sequence of things, or are you talking about a direct effect?
It's a direct effect. And also likely as you're healing, you're going to regenerate those cycles that you're talking about. Okay. But this is a direct oxidative effect. So the oxidative stress itself causes reactive antioxidant capacity to...
So it's hormesis?
Hormesis, exactly.
Okay, great.
Yes,
okay.
It's hormesis. That's the perfect word.
What's that? My favorite word.
It's a fantastic word.
This fella had the first hand up over here.
It's like getting some exercise. Go in your chamber.
Yes, go ahead. Could you stand up, please?
I'm going to take this and move.
On the slide when you mentioned the exponential stem cell
Yes.
Release and the new stem cells that's being released in the hyperbaric oxygen, from some of the physicists and some of the cell biologists I spoke to, there's been this controversy that the stem cells actually do better in hypoxic environment. So is that something that you're aware of, or can you go into an explanation and kind of give me a better understanding of that? Because when we do, what we're trying to do is what we're trying to figure out is if we give an injection, stem cell injection, whether it's neuropathy or any sort of orthopedic injections, is it viable, or will the cells actually proliferate, being that we give them more sessions in the hyperbaric chamber? So if you can elaborate on that for me.
Sure, that's a really interesting question. I can tell you my experience and some of the literature. We understand stem cell release in a hyperbaric environment directly, again, as a result of the oxidative stress on the bone marrow itself and on the neurologic tissue itself, releasing stem cells that are already there. So those stem cells have already been made, but now instead of being encased in the bone marrow or in the neurologic tissue that it was made in, now it's being released into circulation. So it's the exponential release of those stem cells. We also know that there's some literature, at least, that shows that when you combine hyperbaric oxygen therapy with PRP, that those growth factors and that inflammatory response that occurs as a result of PRP, hyperbaric therapy and the stem cells that are being released seem to home to that area and then help that area heal faster. As far as the combination of hyperbaric oxygen therapy, the endogenous release of stem cells that I'm talking about, along with the exogenous administration of stem cells, that data is still not out yet as to how exactly that works best. It's an interesting idea. If you're producing hypoxia, does that make stem cells home to the area more because there's going to be more inflammation in that area? I don't know. I mean, what I have seen in my clinical practice is that if we give somebody a round of hyperbaric oxygen therapy, they go get stem cells, their effects are accelerated dramatically. I can think of one traumatic brain injury patient that I saw, got 40 hyperbaric sessions, went down to Mexico, got umbilical cells, and then he went from 80% better to 100% better. And then he remained that way for about 6 to 8 months until he needed more hyperbaric therapy. And this is the challenge with stem cells, and as you know, is that if you don't have the foundation before you give stem cells, for most people, the effect wanes within 6 months to a year. And so my role, and one of my goals with the health optimization medicine piece is how do you maintain that foundation? How do you create that? And so maybe this exogenous plus endogenous stem cell combination can work. One of the other things that we're doing in the chamber, not for cancer, but for other conditions, is that we're doing something called air breaks. Air breaks in the chamber are used to prevent oxygen toxicity, but they also cause a relative hypoxia. So you're basically breathing 100% oxygen at pressure, and then at about 30-minute mark, you have somebody breathe 21% oxygen or room air oxygen for 5 minutes. So that does two things. It prevents oxygen toxicity. The second thing it does is it also causes a relative hypoxia, which creates a stress, another hormesis, to help induce vascularization stem cell release via HIF-1 alpha. Now, I talked about HIF-1 alpha earlier as a hypoxic stimulus. So we don't usually give air breaks for patients that have cancer. But for others, it does seem to have a significant effect in improving stem cell release. That's my answer. So it's not a complete answer, but it's an interesting question.
Dr. Sherr?
Yes.
Here.
Where are you? Oh, hi.
Hi. It's an excellent talk.
Thank you.
We actually had to try once in mouse with ovarian cancer. They have ascites in the belly already. So to use hyperbaric oxygen and high-dose vitamin C.
Oh, okay.
Yeah, but then we found that the hyperbaric oxygen increased ascites volume. So I don't know if it's from the pressure, you on and off of the pressure, or something. I just wonder whether you see that in any case in your clinical, or is that a concern?
I haven't seen that happen. We have limited experience. I have had a couple patients with ovarian cancer and ascites, and I haven't seen that happen. However, it's something. One of the things that I always recommend, and I mentioned this earlier, is that we have to start low and go slow, because you don't know, everybody's different, and everybody's pressure deregulation as a result of that, of getting ascites, is different. Is it because they have compression of their SVC or their IVC, or is it because they have tumor on their omentum that's causing more fluid to build up? And I think some of that might also play into it as well. I think it remains to be seen what hyperbaric therapy would do for ascites directly, but I also think it probably depends on the etiology of the ascites itself and the greater picture of what's happening. But that's why I always start low and go slow, because you just don't know. Every patient is different. Yeah. Thank you, though. Yeah.
I have a question.
Yes.
How does this compare with exercise with oxygen, like LiPo2 altitude contrast therapy?
Yes, I know LiVo2 well, and I know their videos say they're just as good as hyperbaric oxygen therapy. But they don't have any proof of that, right? However, I do think they're up to something. I do think that the combination of the hyperoxic and hypoxic stimulus to help with oxygen delivery makes sense. However, there's still no pressure involved. That's the key of what hyperbaric therapy is doing that no other therapy can do without it, is we are giving the body a physiologic pressure that's driving more oxygen in circulation. You can't do it any other way. You just can't. And you can't get 12 times more oxygen in circulation without being in a hyperbaric environment. And so can LiVo2, however, modulate that effect over the long term in somebody that does well in a hyperbaric environment? Or can it synergistically work with what we're doing? I think that's absolutely possible, absolutely possible. I just don't know the answer to that. I've had a couple patients that have not been able to get to the hyperbaric chamber, and they've done LiVo2, and they've had improvements in their quality of life. And so I can say that for sure. I do worry about the hypoxic stimulus a little bit, though, because of what we were talking about. The hypoxic stimulus, meaning hypoxia, is what we think is one of the reasons cancer does grow. So even if you're giving these short-term intermittent hypoxic events and then flooding the body with oxygen on the LiVo2 machine, is that a good idea? I just don't know. So the answer is I don't know. It's your turn. Right, but you're also causing more hypoxia too, right? So temporarily, sure, but that's still going to be enough potentially to cause, I just don't know, I keep saying that, but I just don't know. Sure.
Just before you turn time over to questions, you said that maybe in the future there'd be a way to be able to make the lower pressure systems work better. Is that by supplementation or something? Are there certain supplements that can improve? I know, for example, vitamin C, glutathione, alpha-lipoic acid. Those things can have that effect. There's also DCA, which is
right,
and some other things.
Right.
Is that what you're talking about?
Yeah,
what would they be?
Yes, exactly. So in combination with other therapies like those, some that increase vasodilation, others that increase oxidative stress and anti-tumor potential, absolutely. So I do think that over time, what I'm seeing in the clinics around is that we're not going to as deep a pressures as we were. So initially when I started this 4 years ago, we were going down to 2.5 atmospheres, because that's what Dom used in his studies in Florida, 2.5 atmospheres, 90 minutes, 3 times a week for 40 sessions, or for 2 months. It was 2 months, excuse me. So that's how it all started, and that's how I started. But then I realized, well, then if you're also increasing all these other oxidative therapies, maybe you shouldn't be going that deep, at least not initially. And then, I mean, the beautiful part, of course, if you have markers to follow, if you have other things to follow while you're going along with it, that's obviously ideal. And so clinics around the country that are doing this are looking at markers, using less hyperbaric therapy to start off with. And so I do see most likely in the next 5 or 10 years, we're going to probably be at pressures between 1.3 and 2 atmospheres versus 2.0 and 2.5 for most indications. But it's still early in that process.
I have 2 questions.
You're only allowed one. Just kidding. No, just kidding.
Well, one's a question and the other one is a suggestion that I'm looking for.
Sure.
The first one is, could you please kind of go over briefly again about the what athletes would do when they would remove their own blood and then let it regenerate and then inject it back in? Okay, and also, I'm looking actually to get a hyperbaric chamber for personal use, and I looked into like these portable chambers. Do you have any suggestions about that? And you think they're as good as the full size ones, and so on?
Let's talk after, because it's a personal question.
Yeah,
and it depends on the person, honestly.
Okay,
but the soft chamber market in general is not regulated at all. And so there's lots of players in the market that will tell you their chambers can do everything that they can do. I do not agree with that. What I often tell patients is that you should never go into a soft chamber. This is universal. You should never go into a soft chamber if you have an open wound, if you have any of the FDA-approved indications, if you have an autoimmune disease, and especially if you're sensitive to chemicals. Okay, and if you have an ongoing infection. Those 4 reasons should preclude you from going into a soft chamber 95% of the time. The rest of it is personal, so we'll talk about it. Yeah.
We're going to have to wrap this, but I have one question I just have to ask you.
You get the last word.
Since Frank is here, how would you sequence hyperbaric oxygen with ozone therapy, or what would there be an indication for that?
Frank, do you use hyperbaric in your clinic? Or? Yeah. No. So there are some clinics that are doing both. In fact, there's several that I'm in touch with outside of the United States that are using them. What they're often doing is doing less hyperbaric therapy and doing more ozone. So basically doing some of both. And a lot of it depends on the day as to what else is being used that day, as far as what are their treatments, what other protocols they're using. Are they doing nutrient repletion, immune support, or are they using more oxidative therapies? And so they're both oxidative therapies. We know that ozone's an oxidative therapy. We know hyperbaric therapy is an oxidative therapy. What I think hyperbaric therapy is doing differently, and Frank could tell me much more than this, but I think we're getting more oxygen in the system. I think we're more able to reverse hypoxia better in a hyperbaric environment. So I think it's being used more as a sensitizer rather than as a direct treatment, right? So, and that's also something you mentioned. Hyperbaric therapy is not a treatment for cancer. It is a synergistic approach to cancer therapy, period. So I don't pretend that hyperbaric therapy is a treatment. I do think ozone in itself may be for different reasons, but that's how I'm seeing hyperbaric therapy used with ozone, more as a reversing hypoxia versus an oxidative stress, because ozone is a massive oxidative stress as well.
Excellent answer.
Yeah.
Do you have any